Hello, my name is Dr. George Gonzalez, and today we are going to be demonstrating my 5-minute fix for the frozen shoulder. Now, I use the word 5 minutes just because it's catchier than saying 1 minute or 2 minute. It doesn't really take 5 minutes to do. It's actually very quick. Most people, you could clear out their shoulder within 30 seconds or so once you understand the process of how it's done. But when we talk about frozen shoulders, of course they vary in degrees. Most people have what they call a frozen shoulder, even though it's not a true frozen shoulder, and that would be limited by their range of motion. You know, a lot of people get stuck at the 30-degree mark, the 90-degree mark, the 120-degree mark, and then, you know, sometimes at 160-degree. But most of the people, regardless of what's going on, they'll have proper range of motion. Then when they get to the area that's stuck, they start recruiting their body to try to lift it up higher than it's able to go. So when we do this, I'm going to walk through step by step how it's done. But first thing I want to do is talk about the joint itself. So I check his range of motion, and without pushing very hard, he locks out between 90 and 120 degrees. And what I'm feeling in my hand is his clavicle jams up, his trap is getting all bunched up, you know, from trying to recruit the muscles, and his scapula is not dropping and moving down and out of the way to allow for full range of motion. Okay, let's check this side here, and you know, even worse on this side. And I don't know if you could see this trap bunching up here, and you could probably see the expression on his face here. Okay. Does that hurt a lot?
A little bit, yeah.
A little bit? Okay. Does one side hurt more than the other?
The left.
The left side hurts more?
More, yeah.
Okay. So what we're going to do is just first demonstrate how this is done, and then we're going to teach you how to do it. Okay. So I'm going to use my arthro-stim, and big deep breath in. Okay. So shoulder number 1. So it didn't take 5 minutes. Did it what?
I almost fell backwards.
Well, it didn't take 5 minutes, but we improved the range of motion on his right side. And let's check the left range of motion here before we get started. It's still jammed up. Okay. And sometimes by fixing one shoulder, you'll fix the other side, just because the whole shoulder girdle works together in movement. Okay, and let's check this side. This was the more painful side, and it's much improved. It's not 100%, but it's much improved in his range of motion. So if you notice, he still recruits, he still tilts his head to the side when we move the left side as opposed to the right side. Okay? So, excellent. And we recheck our work, and he's doing very well. Excellent range of motion and everything. Big smile, right? There it is. Okay, so those are the basic steps for the frozen shoulder work. Of course, we want to follow up by using the GRT light on the nerve root to the neck to strengthen the nerve, increase the nerve's ability to handle stress. Just stimulate here. It's an amazing technique. We're getting amazing results. I highly encourage you to continue with learning this work, to getting all the patients, your family and friends well. How's that feeling, Vicente?
Very good.
Yeah?
Yeah.
Excellent. This stuff works, huh?
Oh, yes.